Hello, everybody. We're going to try something a little different today. We're going to have a quick segment. And for today, we're going to be talking about
congestive heart failure. It takes people back to the hospital more than any other diagnosis.
congestive heart failure.
Yeah, quick hits, congestive heart failure. Yeah, I think some topics probably don't require an entire podcast episode.
Whole episode, right.
But if you, certainly though, if anyone out there is watching or listening and says, hey, no, please do, by all means, we will oblige. But I think congestive heart failure is probably the most appropriate diagnosis to talk about for just a quick hitter, because it is so extraordinarily prevalent. Everybody's been touched by it, whether they themselves have dealt with it, whether they know a relative who's dealing with it. It's actually the number one readmission diagnosis. So,
Really?
And sadly, one of the things I'll sometimes see is sort of this merry-go-round of hospital admissions. If they start getting admitted with, basically what you get admitted with congestive heart failure is fluid overload to the point where it's affecting their breathing. And then their oxygenation is dropping and they're getting short of breath and they're swelling up. And so this is what they're getting admitted for, is to help get some of that extra fluid off. But I sadly will start to see this sort of revolving door like phenomenon where folks will end up back in the hospital. And that's usually not a good sign.
Of course not.
Because that indicates that the heart is further either weakening or its ability to keep up is diminishing, frankly.
All right. So tell me what it is.
Yeah. So what is heart failure? Well, heart failure comes in two different forms, and most people are probably aware of the first one. That is what we might call systolic dysfunction. And so, or the medical term now is congestive heart failure with reduced ejection fraction. So if anyone out there has ever had an echocardiogram done, ultrasound of the heart, they've looked and they've seen what their ejection fraction was. And that is, in simple terms, the amount of blood that is in the chamber, the left ventricular chamber, the amount of the blood that is ejected from the heart with a single beat. And interestingly, it's not all of it. And actually, you don't want it to be all of it. So it's about 55 to 60%. So sometimes people see that and they're like, "Oh wait, that's not good," because if that's a grade in school, that's an F or a D. But that's actually normal to have about a 60% ejection fraction.
I did not know that.
But when you see that start to drop, say below 50%, so 45%, and then all the way down, certainly I've seen as low as 15, 20%.
Oh my!
Very weak heart. But when you see that decrease, that's indicative of a congestive heart failure setting in due to a pump problem. And then there's another form that's probably, it's actually just as common, perhaps more common, probably a little less fanfare, and that is congestive heart failure with preserved ejection fraction. So this is where the pump is actually not the problem. It's that the heart though has likely thickened over time, and this is usually from, say, high blood pressure, diabetes, or obesity, where it's thickened over time, and it's no longer able to relax as well. And so you get impaired filling of the heart. And then, of course, fluid can build up behind that, because at the end of the day, the heart is a pump, and like plumbing, if it's not keeping up, you're going to fill up with fluid behind that. And that's where the heart itself has become stiff. It can be a little more complicated, I suppose, because to a certain degree, as we age, most people will develop a little bit of a degree of this.
Okay.
And where you maybe it doesn't warrant anything sort of dramatic, but it is something worth keeping an eye on, because as time goes on, that certainly can catch up. And then of course the symptomatology becomes difficulty breathing, and swelling.
Okay. Who are the people that this affects?
Yeah. So, touched a little bit on that with high blood pressure and diabetics. Aging is a risk factor too, right? So as we age, we're going to have that come into play. Smokers, I don't know if I mentioned obesity again, but these are going to be the folks who are at the highest risk for congestive heart failure. But you can actually, interestingly, get what's called idiopathic. So maybe no other explanation. And actually here's maybe an interesting one for you.
Okay.
There's actually something called takotsubo cardiomyopathy. This is the medical term for broken heart syndrome. So you can actually develop
There's a medical term for that.
Yeah, it's It's maybe not
And it
quite.
starts with taco.
Starts with taco, and not in a good way, I guess. But yeah, takotsubo is where there has been a dramatic, typically a dramatic emotional event that has resulted in a significant release of what's called catecholamines. These are sort of stress hormones, adrenaline, things like that. And it has overwhelmed the heart, and it has caused the heart to significantly weaken. And actually, if you do an echocardiogram on those folks, there's a pretty, what we call pathognomonic. So there's a pretty clear sign of takotsubo. The good news is most people with this will actually have complete recovery of the heart. This is
That's good.
which is great, right? And that's actually, well, maybe piggyback on another interesting tidbit though. People who have reduced pumping of the heart, if they get put on the appropriate treatment protocols, you can actually get improvement in heart function. You can actually see that pump recover a little bit. And so this is one thing in medicine, a lot of times we're just trying to kind of damage control things, right? Like trying to reduce the misery, which obviously is important. This is one area where we can actually see improvement if treated appropriately. So this is why it's so important to, I know I sound like a broken record probably, but this is why it's so important to follow up with your doctor regularly and have a good relationship. That way you can make sure that we catch these things early.
Absolutely. Check in with your PCP.
Check in with your PCP.
All right. Any other facts that we want to throw out for that?
Yeah, I think maybe one that some folks may find interesting. One of the signs of congestive heart failure I mentioned, fluid overload, swelling. The other one is breathing. And this one sometimes gets overlooked because there's actually a phenomenon known as orthopnea. And so one question we ask people if we're concerned about congestive heart failure is, do you have trouble sleeping? Or maybe more specifically, do you ever wake up gasping for breath? And if the answer is yes, then that could indicate something called orthopnea. And then the follow-up question is usually, well, if you prop, yourself up with 2 or 3 or 4 pillows, or if you find yourself going to the recliner because you breathe better when you're upright, this is actually not a good sign because a lot of times when we're sleeping and we're laying flat, a lot of that fluid that maybe has exited our blood vessel and found its way into our feet and our ankles and our legs, a lot of that fluid starts to reabsorb back into the bloodstream, which means that it is now circulating back through the heart and the heart can't keep up. So it pushes it into the lungs and then we can't breathe unless we use gravity to help us. And so that's one problem. That's also, well, this is maybe not to do with congestive heart failure specifically, but that's also why a lot of people end up having to urinate more at night. So if someone's like, hey, I go all day, I hardly have to pee, and then at night, it's like I'm up 3 or 4 times. Well, it could be a prostate issue in men, but it also could be that, well, that's because we're reabsorbing some of that fluid, and so now the kidneys are actually being put to task.
And they're working in overtime.
They're working overtime while we're sleeping, while we're trying to rest. And so this is where compression devices, compression socks can be useful during the day to keep that fluid circulating. But another little interesting tidbit is if you see swelling in the ankles or feet, and this is another, I guess, key point. Heart failure is generally going to cause swelling in both feet, both ankles, both legs. If you have it only on one side, think local problem, think blood clot, think infection, think lymphatic issue. If it's on both sides, think systemic issue, heart, kidneys, liver. But the other important thing is if you see somebody with swelling in their ankles or feet, there's at least 1.5 liters to 2 liters of fluid in additional to what they should have in their body. And that's minimum. I mean, it could be more. It could be 3, 4, 5 liters extra fluid. And so this brings up another point. This is why it's so important to weigh yourself, especially if you have known heart issues. You need to weigh yourself, and you need to weigh yourself every single day. Because if you gain weight excessively quickly, that could indicate that we're having a problem with our heart. We're not keeping up. And then the medications that we're taking for it may not be as effective, because if you're swelling in your legs, you're also swelling in your stomach. And even though we don't tend to see that as easily, we can in certain cases see swelling. There's something called ascites or anasarca, where you can actually see fluid build up in the abdomen. But when there's fluid surrounding the gut, surrounding the abdomen from our heart weakening, when we try to take medications, the medicine, it has to not only absorb through the stomach lining, but it has to absorb through all of that extra fluid to get into the bloodstream. So this is why medicines become a lot less effective.
Gotcha.
And so one question I'll get asked sometimes is, well, how come my water pill stopped working? It's partly because of that, because now that medication was no longer strong enough to, frankly, to keep up. And so this is where people oftentimes go to the hospital, they get IV diuretics, they get all that fluid removed. And so I thought, this was, and I think that's probably good enough for today.
Sure.
Certainly, like I said, certainly please, if you found this to be informative.
If it's something you'd like to see us dive into a little bit more in depth and maybe answer some questions you might have, or really dive deep and get more information, we'd love to hear from you.
Absolutely. Please do give us a comment. And then I don't know if we said at the beginning of the video, please subscribe if you like this, because this will help us know that you're enjoying this. But until next time, I'm Dr. Todd.
And I'm Phil.
Live well.
Live well, everybody.